So hi guys, we're going live today as I've already announced that we will be going live with one of my past patient, Mr. Lakshay Thakran. So I'll wait for more people to join in. I don't know whether it's live or not. Hi Lakshay, I can see you. Yeah, we have more people joining in. So yes, hi everyone. What we had planned today is an Insta live session with one of our past patients, Mr. Lakshay. So he has had his rhinoplasty done with us, and a lot of people have apprehensions about the surgery. Mr. Vikas. So let's discuss with one of the patient who has had the surgery with us. How has been his experience? And mind you, he had. Hi Lakshay, how are you?
Hey Doc, feeling
How
good?
are you? Yeah, I'm doing good. How are you doing?
Yeah, I'm doing great. I started like working on other things like haircuts and stuff, and yeah, I'm feeling great.
So we'll wait for people to join in. Today is Sunday, everybody's busy. Let's see how many people join us for
Yeah,
this
sure.
session today. So uh, it has been a lazy Sunday. So guys, today we have Mr. Lakshay Thakran with us. He he did his redo rhinoplasty with us around a month back. Lakshay, we did it a 1 month back.
Yeah. I had to go for the second procedure because the first one didn't really did what I was looking for. So we went again, and
Yeah,
it
so
was a
we did
month
your
ago. Yeah.
redo. The first one was done somewhere else. When did we do your surgery? Around a month back.
Yeah. Yeah.
Okay. So a lot of people are apprehensive before rhinoplasties, nose job, because they have heard all the horror stories that people get it done, it looks fake. So here is Mr. Lakshay in front of you. He's not looking at all fake. His nose looks very natural. Of course, he has some swelling on the tip, and the swelling will reduce further over a period of time. So, Lakshay, if you can tell our audience what issues you had with your nose and why did you wanted to go for a rhinoplasty in the first place?
Well, I had a deviated septum, so when I was a child, I got hit on the nose once, and it kind of grew in that way. So it was bent to a degree, and it was such that it had an appearance as well. And I think it did result in me having like breathing problems, which ultimately I want to get fixed. So I went in and got a procedure done in 2013, and it somewhat worked, but not to an extent I would want. So that's why I was looking for other options, greater options, and that's how I found you. And yeah, I would say there's a lot of stigma around it. There's a lot of rumors about it that it'll be painful or it will, not look good or something like that. But what I can say is it's like art. Oh, like I would quote you, it's art. So if you've got a good artist, you'll get a good painting. If you cut corners, you'll get cut corners. So yeah,
Yeah,
I feel I got the treatment I wanted, and it was minimally. I wouldn't even call it minimal compared to my first one, because as I've got it done twice, I would say I have a point of reference. So the first one I had to go under the knife the first time. I had to get those foams for a week, and it was not good. Like every time I would eat, my nose would bleed, and there were a lot of things I didn't like about it. What I really liked was the staff at Rosewalk was really professional. I mean, you visited me for 2 days, I guess, and it was all fine. I have like no problems with the nose at this point. It's like completely natural and fine now. No problems breathing. So yeah,
yeah. And to tell you, redo surgeries are always difficult. But trust me, redo rhinoplasties are all the more difficult. Everything is stuck. The best, uh, treatment a doctor can achieve is in the first session or a virgin plane. So, can you show us from your side views how your nose, how it naturally looks? Yeah, if you can just tell our audience that how much hump you had before and how much it was too high.
I had a hump like this. So
Yeah.
again, it kind of was bothering me for some time. Also didn't look good. Gave my nose a bigger appearance according to my face. And yeah, now it's just completely
Can
straight.
you show from the other side as well? Can you
Yeah.
show? Yeah. Looks really nice. You're improving. In fact, I saw you 2 weeks back. You're looking much better. Of course, your tip has swelling, and the swelling will keep on reducing over a period of time.
Yeah, yeah,
So,
no, I know the difference between like
someone is
two to
asking
three
for old
days
pic.
even.
Do you have your old pic right now on your this thing? Let me see.
Um,
I can check out. Can you tell me the
yeah,
date for your surgery?
I'm I'm not quite sure. I guess it was on the 12th or the no, no, no. It was I'm sorry, I'm not good with dates, but
Last month, right? We did you on July.
yeah, yeah, yeah.
Oh, I found your picture. I found your picture. That will be great. Let me show you. I'll just switch my so, turn my camera on and you see. So guys, this is how he looked like, right? And this was. I hope you can see how unnatural the hump was and how depressive there was above the tip, supratip depression. This is how his pictures were. And you can see from front how deviated it was. Lakshay, can you see that? It
Yeah,
looks a huge.
that's one of the that was one of my main issues with that because the first surgery kind of looked fake, and that's the reason I wanted to get another one to like get the natural look I had like even
It
before
was.
that.
And see from the side as well. It looked. Thank you, Vikas, for appreciating our work. And see, this is how it looked like, and he had the sum. So, Lakshay looked really nice. Of course, the best is yet to come after rhinoplasty. We can always tell that it keeps on improving up to 1 year. Now, let's say a lot of people have apprehension about cosmetic surgeries, whether they should get it done or not, whether they should get it done from India or not. A lot of people have this apprehension. Can you just tell them about your experiences and your thoughts about it?
Well, my thoughts about the matter is that first of all, India as a place has really great standards when it comes to anything. It's just that most of the people prefer to go and outsource their work to other countries. I would say with Dr. Rajat, I've come to other live sessions and I've seen like people from Africa getting their surgeries or people from France. So, you know, if people are coming here to get their surgeries done, it means like you are in the hands of a professional. There's so much uh, he keeps up with you. Like even after post-op, you know, I can call him anytime during the day and he would give
Of
me
course,
advice.
you see, I always insist that each of my patient gets not only my number but my team member's number, my nurse, my other plastic surgeons working with us. Everybody gets. This is the least we can do as doctors. That a patient who has got their surgery done from you can connect with you any time of the day or night. And this is very important because I always believe if someone is connecting with you, trying to contact you, they feel it's an emergency situation. And if you are not there for them, if you're not available for them, uh, it shouldn't be. So I'm always there. You've been going through that, yeah.
Yeah, yeah. And about the question about the precautions, I would say I was just advised to like obviously not get it on the nose. I guess that's a
Yeah,
pretty
avoid any
normal
trauma
one.
to nerve. For at least first
Yeah,
3 months, be extra cautious because
yeah,
that is important.
yeah. And about normal day-to-day work, I didn't have any problems. I could do normal day-to-day work. I was advised not to do cardiovascular exercises, which is like running and stuff. So I like didn't do that for like a week or two. But after that, I was going
Yeah.
back to do exercises and stuff. So yeah, pretty
So
normal.
my next question to you is, how did you decide to get your surgery done from us, or how do you advise someone else on how to decide to who to go for their cosmetic surgery?
Well, I would always say just go and like keep a standard to yourself. I wanted the best thing I could get done because the first thing was that I already got this procedure done. So I didn't want to go under the knife a third time for the same thing. And I didn't want any regrets. That's what I live in life with. Like I don't want any regrets. I want the best stuff done, no matter what I have to do. So I came across Dr. Rajat when my mother was recommended him through a friend who is also in the field. She's also really good in what she does in dermatology, and she recommended Dr. Rajat. I still had some skepticism. There's always something
Of
going around
course,
in
of
your
course,
mind,
of
like
course.
maybe this guy like has paid someone or something. Like that
Of
was
course, I
always
know,
in
I
my
can
head.
imagine that.
Yeah, yeah,
So,
yeah. And
someone is
and
asking
when
what
I
surgery are
visit,
you talking about? We are talking about rhinoplasty, the nose job. Yeah, go ahead. Sorry.
yeah. So when I visited Dr. Rajat, it was something different. Like anytime I visited someone, they wanted me to stay. So they'd be like, "Oh, reassuring you," and like just going, like lulling you into a sense of like,
I
"Hum se
didn't
hi lo."
reassure you. I didn't reassure you. You mean to
Yeah,
say?
yeah, yeah. No, like you did reassure me, but there was like a certain confidence that a lot of people don't show. They think it'll scare like people away. You were like, uh, I am your doctor. Like I am your doctor. We are not talking about if or what's. You'll definitely get this, and I'm your doctor, and that's it. And I really like that confidence because you knew what you were talking about, and I like that. So
I'm very
yeah,
blunt. You know it. You know it. I'm very blunt.
yeah, yeah.
I tell what will happen, what will not happen, what we can improve, what we cannot improve.
Yeah, yeah. You were completely realistic about what can be done, and fortunately, it was in line with what I was looking for. So yeah, I'm completely satisfied with the procedure I got. I'm really happy with it, and I would say whenever you want to get something done, just try and research as much as you can. That's how I found out.
Absolutely. Check for the qualifications, the person's work, and talk to the doctor. See who you become comfortable with, who you vibe with. Someone is asking how long was the surgery for. So typically, rhinoplasty, I do not take more than 1.5 hours. Maximum is 2 hours. But I remember for Lakshay, I think we took around an hour. Hi, Aisha, how are you? So around an hour we took for his surgery, and especially because this is commendable. I think I'm proud of the work because it was a redo surgery. Uh, at the same time, Lakshay, you see, a lot of people think when we go for a nose job, some actors went and it looks unnatural. What I always insisted to give you a natural look, right? No, if you meet someone, if you go to a party or a next door neighborhood gathering, nobody is going to tell you, "Oh, Lakshay, it looks like you have got a nose job or rhinoplasty," and that's what
Yeah.
I think is the most important thing. If it shows, it's fake, isn't it?
And I would
I,
actually make the point that if it looks unnatural, like in my case, that hump and that like deviation in the septum, it always looked unnatural to me. And I would just say like whatever looks natural, if you think about it, if I never got that injury, it would look natural, but it didn't look natural when it was that way. So I just say go and get stuff fixed if you want to. That's what I did, and
okay,
I'm happy with the
so
results.
tell us about your recovery. How long was the splint? How was the pack, nasal pack? You had any difficulty in breathing? Just take us audience about your recovery because they would like to hear from you.
Well, it was a week. No, the uh, I think my nose was completely covered for about 2 days. So
Mm,
those were a bit uncomfortable, but then again, there's no alternative. So you have to go through that. But my splint was around for a week. So I had
yeah.
to keep that on. And that's just for like your protection. You don't want to like injure yourself while you're sleeping, or you don't want to
Any
injure it
pain?
by,
Any pain you had? Pain. A lot of people
no,
are
no.
happy for pain.
No, with the medication I was on, I didn't have any pain. It was pretty effortless. Like I went to sleep. I woke up for like a week, and that was all the work I had to put in. There was no pain at all. So
Yeah, so that's important point because a lot of people are apprehensive about pain after rhinoplasty. And Mr. Lakshay, even though he had a redo surgery, which is all the more difficult and all the more fibrosis and all the more swelling, he didn't have any pain. And that's why I always tell my patients that after rhinoplasty, you will not have any pain. Of course, swelling and bruising is part and parcel of it, but there won't be any pain. So, Lakshay, a lot of people think that getting any problem in eating or breathing, someone is asking.
I think you got cut off there for a second.
Okay. Someone is asking that any problem in eating or breathing you had?
Well, for the first or second day, like your nose has to is so swollen after the procedure that you
Yeah.
have that there's some, like, I think, pressure differences in your head. So that's something you'll have to go with. But
Yeah.
the thing in that scenario is, with Dr. Rajat, you'll maybe experience it for like a day or two, or like in my other experience, I had to go through that for like a week, and breathing was normal after like the third or the fourth day. So it was
Yeah.
completely normal afterwards. Didn't have any problems. So
Any issues with eating?
yeah, no issues. I was eating fine. I was.
I hope you like the food at the hospital. We make sure that our patients get good food though.
It was good. Yeah, I had healthy food. I had porridge. I had omelets. So that was easy on my throat because it was a bit sore after the procedure. But yeah,
Yeah.
no problems.
Okay. Now, a lot of people keep thinking about cosmetic surgery, but they're apprehensive that it's for our own vanity. How important it is for your one's own self, one's own confidence.
Well, I would say it's more about what you're willing to do for yourself or not. Like in my case, I always kind of felt cheated by that one injury. Like if you think about it, your confidence is just taken away by that one instance in your life. And then you're just left with this feeling like, oh, what it could have been. And
Hmm.
I'm always a go and do it guy. Like if I don't like it, I'll go and get it done.
And
So
why not? Why not? These things can be
yeah.
fixed easily these days without any complications. Why not?
Yeah, and I was particularly adamant about just doing whatever I wanted. Like I didn't want to, like, have difficulties breathing anymore, and that was always looming over my head. Like I got this procedure done, and like there'll always be people who'll just like end up assuming like you don't love yourself, or something like that. And I say, like,
In fact, it's the
like,
other way around.
yeah, I would just say, like, let's assume you love your parents, right? You would get them stuff, like, not someone you, you love something, or like giving them something they want. And if you love yourself, you will probably want the best version of you out there.
Exactly. And exactly. I think it's the ultimate love you can do with your own body, that you can do something to improve it. A lot of people spend lots of money on clothes, on watches, on what all things. But these are materialistic things. If you can improve the body which God has given you, nothing like it, isn't it?
Sure, yeah, definitely.
So, great. Any message you want to give to our team, to our audiences who are here before we wind up this session?
Well, I would just say that you know you only have one life, and if you want to sit around and sulk and like be tied up in preconceived notions by society, that's what you want to do. But if you are ever willing to like step into those shoes where you can be the best version of yourself, I can say with confidence that Dr. Rajat will have you in his great and excellent and dexterous hands, and will give you the best version you can be. He has a professional staff that has helped me throughout the whole process. Never did I ever feel that in the end I'm gonna regret it. And in the end of the day, I think that's what matters, if you regret your decisions or not. And I don't.
Yeah. So thank you for doing this, Lakshay. I enjoyed this. We had few questions as well. We had, if any people want to ask, they can write into us or me and connect with Lakshay on Instagram. I'm sure he will be able to tell about his experience and guide someone who is contemplating rhinoplasty or nose job. So, see you around Lakshay after a couple of months for your follow visit in my office. And it was lovely catching you on this Sunday evening.
See you, Doc.
See you. Bye bye. Take care.